हाँ 131 है.
Okay. So, okay. Assalamu alaikum everyone. And I'm Dr. Ramsha Urooj, and we are going to be talking about arsenic today. The main things that we're going to discuss today would include how does arsenic have a poisonous effect on our body? What are its chemical properties? What would be the clinical sign and symptoms that somebody who has just had arsenic in his body would have? And lastly, we're going to talk a bit about treatment and obviously the medical legal aspects of arsenic poisoning. All right. So it's a pretty simple lecture today. There's nothing that should be difficult for you guys. So let's talk about arsenic. It's a white crystalline powder. Okay. And the most important thing about arsenic is that it has no smell or taste. Now, why is this important? Because it can be easily given for homicidal purposes. Like someone can actually mix it in some food or drink or anything, and the person who would be having that will not even suspect of any poison that has been mixed in their meals. Okay, so that is why it is very common to be used as a homicidal agent. All right, now uh, then there's the point that it can be non-poisonous if it as it is insoluble in water. All right. So what happens is that it is incapable of absorption from the elementary tract. However, an exposure to air can change into arsenic oxide, which is the most poisonous form. Right. So if you're if you're mixing it in water, it would be insoluble, and it would be obviously when it's not soluble, it won't get into the GI tract easily. However, when it gets exposed to the air and forms its oxide, that is poisonous, and that can get into the GI tract very easily, right? Now, what is the main mode of action? Why is it so deadly? Arsenic. Now, what happens is that there are certain sulfhydryl groups on certain enzymes in our body. The chemical structure of enzymes, if you remember from your biochemistry, you might know or recall something called a sulfhydryl group that's present on many enzymes and many protein structures in our body. What arsenic does is it combines to this sulfhydryl group, and it blocks its action, the enzyme's action basically, by combining this group, and therefore interferes with important metabolism procedures and functioning of the cell. Okay. Now, these are some of the arsenic compounds that you should be knowing of. Now, the thing is that why do you need to know about them? These are the potential sources of where people can get exposed to arsenic, like arsenic dioxide. It was used once, like when we didn't know that arsenic was poisonous. It was used in medicine for treating fever. So back in the days when they didn't know that it was poisonous. It was used as a fever medication, just as a Panadol. Then there are some sulfides of arsenic, like arsenic disulfide. You don't need to remember the names. This is just there to make you realize how easily one can get exposed to arsenic. Now, this sulfide of arsenic can sometimes be used in depilatories. What are depilatories? Those hair removal creams and all those things, remember? They can have some arsenic in them as well. Then there are some copper compounds of arsenic. These are very commonly used in coloring agents of toys, wallpapers, anything that has color in it can have arsenic as well. Then there are some arsenic compounds with lead, sodium, or potassium. These compounds are used in insecticides, fungicides, weed killers, like all the gardening stuff. The insect killer stuff is there. It can have arsenic in them. And then lastly, there's arsenic gas, which is widely used in industries and laboratories, right? So this is how potentially one can get exposed. Now, A very common way. Oops, what happened? Mhm. I'm sorry. क्या हो गया? Okay. I'm sorry for the interruption. So, the most common way, these are some rare cases where one can get exposed to arsenic. However, there is a very common way to get exposed, which is from drinking well water. Arsenic is commonly found in soil. It's one of the compounds of soil, and some areas the soil is heavily abundant with arsenic. So what happens is when people drink the well water, which is just unfiltered, unprocessed water directly coming out from the well, they can have they can just get exposed to very high levels of arsenic and can develop chronic arsenic poisoning. Okay, so the most common thing that you need to remember for arsenic poisoning would be somebody who's drinking well water, right? These the things that we've just talked about are also potential sources, but the most common one, which has been widely reported, is someone drinking well water, or they're using well water in their daily uh, activities, and that's how they're getting exposed to arsenic. Okay, so let's talk about acute poisoning. So the main thing that happens with acute arsenic poisoning is that the person would develop GI symptoms. What are GI symptoms? Nausea, vomiting, upper epigastric pain, diarrhea, cramps, abdominal pain. These are all the GI symptoms. Okay? Whenever the GI tract gets disturbed by any reason, it's not just arsenic. These are the upper GI symptoms, or the low and the lower GI symptoms combined. So, arsenic poisoning, acute one, would give us simple GI complications or disturbances, right? What are the gastroenteric symptoms that encounter with arsenic poisoning? Now, symptoms begin as early as 15 to 30 minutes, right? However, it can be delayed, but it's not that much big of a delay. Just remember, it symptoms start pretty quick. Like if someone ingested, within 15 minutes or half an hour, they're going to have some symptoms. What would be the symptoms? It's GI symptoms that we just talked about: nausea, vomiting, epigastric pain. That would be included with vomiting. Vomiting would consist of the stomach contents at first. Obviously, the stomach's full, so when it's going to blurt everything out, the stomach contents would be. After that, vomitus would consist of some blackish or greenish substance, which is basically bile, right? And finally, because of the local erosion of the GI lining, the vomitus would have blood in it. Okay, so at first it would be just the stomach contents. Then, when the stomach contents are just gone, bile takes place. Bile gets out, and then finally, due to the corrosion that's happening within the GI lining, due to the local irritation of arsenic, there would be blood and mucus that would come out in the vomitus. All right. Then, as the arsenic goes down, it's going to produce diarrhea, which would be accompanied by tenesmus. Tenesmus is basically a feeling of incomplete evacuation. It is a classic sign that shows that the GI lining is being triggered so much that it's just undergoing rapid peristalsis. And that's what arsenic is doing. It's a GI irritant. It's going to produce rapid peristalsis. It would cause local irritation, inflammation. That's why people would suffer from tenesmus. Okay? A feeling that they have to go to poo. Okay? All right. So, due to the local irritation and damage to the GI lining, the stools would also have blood. They would be watery, and this is something interesting, that they look like rice water stools of cholera. at first. Okay, at first the stools would be watery, right? Just like with the vomitus, at first we had the stomach contents all out, and then there was bile, and then when there was nothing left, blood started coming out, right? Same is the case with diarrhea. At first, it's going to irritate the GI lining. The irritation of GI lining would cause heavy influx of water within the GI lining, and that would produce something classic as rice water stools of cholera. And then after that, there would be blood. All right. So over here, when we see rice water stools, if somebody just gets into the ER with a complaint of rice water stools, we might think of cholera. We might not think of arsenic, right? So we need to perform a differential diagnosis. That will be coming up next, don't worry. After that, there will be some painful cramps in legs. Why? Because obviously cramps are a sign of dehydration. Remember, whenever there are painful cramps in a person who's having profuse diarrhea or vomiting, you should think of dehydration. And finally, when the body starts to just give up, it can collapse due to shock. And this would be a shock due to dehydration, and that is why it would show signs of cold, clammy skin. There would be pale face, sunken eyes, and finally, it can also lead severe dehydration can lead to convulsions, severe convulsions because of electrolyte imbalances, or even coma that can lead to death. Right? Okay. Now, if someone takes arsenic in very high doses and acutely, like all in one go, and the dose is sufficiently large, the GI symptoms are not there. Now, we don't know exactly why this happens, because at first arsenic is irritating the GI lining and all, but when taken in extremely large doses, it doesn't produce that much of GI symptoms. There may be some mild nausea or epigastric pain, but nothing very significant that we should term it as GI symptoms. However, the large doses of arsenic produce some narcotic actions. Uh, what do we mean exactly by narcotic action? They would include vertigo, headache, convulsions, stupor, which is basically confusion, and finally vascular collapse. Okay, so it's all related to the brain. It's going to suppress the brain activity. It first leads to dizziness, headache, convulsions, confusion, and finally the person would collapse. And if this happens, like if it's the narcotic action that's going on, death can occur as rapidly as within 2 to 3 hours, because this is very significant. The convulsions are very severe. They cannot be stopped, which causes permanent brain damage that can ultimately lead to death. Right? Now, you don't need to remember the fatal dose. It's just a matter of numbers, but just to be sure, it's around 200 mg for adults. And however, even 100 mg can cause death. So it's not that predetermined. For fatal period, in cases of the narcotic form, where someone has taken extremely large doses and his nervous system gets involved, he gets confused, he experiences fits, he's feeling dizzy, death can be within 3 hours. However, if there are the GI symptoms predominantly, then the fatal period can vary from 12 to 48 hours, provided treatment is not given. Okay, so remember we talked about the rice water stools that we see with acute arsenic poisoning, which are very classic for cholera. So we need to differentiate between the two, remember? So this is the differential diagnosis. Now it's pretty hectic for the chart, but let's walk it through. So for pain in the throat. Okay. For arsenic poisoning, it would be before the vomiting. And for cholera, it's going to be after the vomiting. Now, why is it before for arsenic poisoning? Arsenic here is a poison, remember? And it's going to irritate the throat. That would cause pain in the throat even before vomiting. And in cases of cholera, it's due to the irritation after the vomiting. Okay. For vomiting, it precedes diarrhea. Okay. And for cholera, it follows diarrhea. Now, why does it precede diarrhea? Remember, somebody who's ingesting arsenic through their oral cavity, it's going to go to your stomach. I'm really sorry for the bad diagram, but it's going to first go to the stomach here, and it's going to produce the irritation. Remember, and this will try to blurt it all out, right? So that is why you see vomiting before diarrhea, and the rest of the arsenic that's left after diarrhea goes down to produce diarrhea. All right. But first there would be vomiting because that's the way arsenic is coming in. It's causing irritation, and that's why there would be vomiting. Okay. You should be able to identify arsenic versus cholera, right? This is important. So what would be in the vomitus? Mucus, bile, blood in case of arsenic. Remember, arsenic is irritant to the GI lining, and that is why it's going to produce some bleeding. For cholera, it would be some watery vomiting. That's it. Okay. Now, stools. Initially, you would see rice water stools. Okay. But at later stages, it will be bloody. It would turn bloody. Why? Initially, due to the local irritant effect of arsenic, it draws in all water, and that is why you see those rice water stools. However, when everything is sucked out of the GI tract, all of the water, then arsenic tends to cause the damage and starts the leaky vessels. Yeah. For cholera, it will be rice water throughout. Tenesmus is very marked in arsenic poisoning. Remember, I told you that tenesmus is a sign, classic sign of lower GI irritation. Okay, something very poisonous or very irritant is there within the GI lining that's causing it to rapidly peristalse, and that is why it's producing this classic feeling that they have to go to poo. Okay. For cholera, it's not that prominent. Then this is very important. X-ray of the abdomen. Arsenic is radio opaque. So when you're going to do an X-ray abdomen, you would see the whole loops of intestine and the stomach within the X-ray, just like barium studies. You must have seen X-rays for barium studies. So it could be exactly like that. Okay, so it can be something that a doctor can pick up. Okay. I'm sorry. For lab test, arsenic can be isolated from vomiting, stool, or urine. And for cholera, it can be isolated by stool cultures. Okay. And narcotic poisoning is present with some cases of arsenic. However, cholera does not have anything like that. Okay, so let's talk about treatment. Obviously, as with any case of poisoning, we start off with stomach washing immediately, right? We just need to get the poison out of the system. Okay? So we just wash the stomach thoroughly. We're going to use some prepared solution of hydrated ferric oxide. Okay? Just remember, ferric oxide, hydrated, is a fancy term. Ferric oxide is the antidote. Okay, it's the antidote. And what happens is ferric The ferric part of ferric oxide binds with arsenic and forms a compound called ferric arsenide, which is harmless and thus renders arsenic to be less damaging. Okay? So just remember ferric oxide to be the antidote for arsenic poisoning, right? Ferric oxide. Now, if ferric oxide cannot be prepared or is not available, you can use magnesia or activated charcoal. However, they are not that significant in stopping arsenic from doing other damage. The classic antidote will be ferric oxide. You can also use butter or greasy substances. Now, why are we using these? We just want to make a barrier between arsenic and the GI lining. That is why we're using these. No alkalis should be given as they increase the solubility of white arsenic. Okay, so no, absolutely no alkalis. Okay, now there's something called Caprol, which can be used as an antidote as well. Now, what does this Caprol do? It basically has some radicals that combine with arsenic and forms a combination and just makes them less toxic. Okay. All right. So, and then this combination that we've just had with Caprol and arsenic, which forms a complex, it can be easily excreted by the kidneys. Okay. We should make sure that the patient is not dehydrated. So IV fluids would be there. And obviously glucose should be administered, morphine to control pain because the patient would have cramps because of dehydration, abdominal pain because of the rapid peristalsis and damage which is being caused by arsenic. So morphine is ideal for pain relief, ice to control thirst, glucose to combat liver damage. Okay? So the main heroes would be ferric oxide, and Caprol. Okay? And rest of the treatment would be supportive. All right. So if someone dies with arsenic poisoning, what would be the postmortem findings? The most important one would be signs externally. It would be signs of dehydration. All right. The patient had suffered from extensive diarrhea, vomiting. Obviously, he would show signs of dehydration, which are sunken eyeballs, prominent bony prominences, skin would appear wrinkled. If there's liver damage, it may also show signs of jaundice. Hands and feet might be cyanosed. Rigor mortis would last longer. Okay. Now, internally, the stomach would show a classic red velvet appearance. It would be extensively red from inside. Why? Because of the local irritation of arsenic. All right, simple. For mucous membranes, they would be covered with blood-tinged mucus, swollen and red in appearance. Again, because of the local irritant effect of arsenic, it's going to cause blood vessels to leak. That is why the mucus is blood-tinged. It's swollen and red because of the local inflammation. Okay, then there would be some ulcerations or even erosions within the GI lining. Petechial hemorrhages can be seen far and wide within the organs. And you should remember that arsenic can be found in the stomach even if it has been given by any other route. Okay, it's not necessary that arsenic should be given via mouth to be present within the stomach. Why? Because arsenic is re-excreted in stomach and intestine, right? This is something that you should remember. Okay? Arsenic is re-excreted. Even if somebody had an injection of arsenic, let's suppose somebody was injected with arsenic, even then arsenic would be present within the stomach because of this re-excretion phenomenon. Then for the mucous membrane, the small intestine, obviously they would be inflamed. Petechial hemorrhages would be within the heart as well. liver will show degenerative changes, and in acute poisoning, putrefaction is significantly retarded. Now, arsenic is is actually retarding decomposition of the body. All right, it is used as, I'm sorry, I cannot get that word, to save organs. Basically, we don't use it actually, but we can use it to make the specimens last longer, okay, because it's going to retard putrefaction, or it's going to stop the process of decomposition. Okay, I hope you guys are with me so far. We are now on chronic poisoning, and this usually happens in workers who are involved in the refining industry, right? Or even with the manufacturers of weed killers, insecticides, paints, or dyes. Okay, remember that chart where we talked about the significant or the potential exposure of arsenic? Okay, and so we people who are involved in manufacturing of all these things can get exposed to arsenic chronically. It is seen in patients who are taking medications that have arsenic in them, and it can also follow acute poisoning when a large dose was taken. However, that is very rare. Okay, so for the sign and symptoms of chronic poisoning, there are four stages. Okay, the first stage is the same, GI disturbance. Then the second stage is called a catarrhal stage, which is just some flu-like symptoms. Then third stage has skin rashes, and finally at the fourth stage, the brain gets involved and shows signs of nervous disturbances. So let's walk our way through. For GI disturbance, there would be some weight loss, loss of appetite, nausea, vomiting, diarrhea. These are all the GI symptoms. Nausea, vomiting, diarrhea, tummy pains, loss of appetite. Okay. Then comes the catarrhal stage, which is just something what we call common cold. Okay. So this would have runny nose, fullness. That's it. You will have some red eyes, coughing, just some flu-like symptoms. That's it. Then thirdly, this is the stage for skin rashes. Okay. Now this here I would like to show you the classic picture for raindrop appearance or raindrop pigmentation, which is very uh, classic for chronic arsenic poisoning. Raindrop appearance. Let me show it to you. I hope if I open my wait, raindrop. I wanted to show you the picture because I hope you guys can see this. Can you see these hands? How it has some spots, so many spots like raindrop. This is the classic raindrop pigmentation seen in chronic arsenic poisoning, right? And for the knees lines, which are also seen in arsenic poisoning, I hope you guys can see my screen because I'm really not sure. Okay, so let me show you. This is the picture from these lines. Now, this is not classically seen in arsenic poisoning. However, it can be one of the signs or symptoms for arsenic poisoning. It can be seen with heart failure, carbon monoxide poisoning, even chemotherapy, leprosy. So it's not diagnostic, but just remember arsenic poisoning can have knees lines, which are these white bands across the nail beds. Okay. Okay. Now let me go back to my slide. All right. So we were talking about the chronic poisoning where there's first stage of GI disturbance, then there's flu-like symptoms, then there are the skin rashes that include, I'm really sorry for this term, it's misleading. You should say skin changes, okay, which include the raindrop pigmentation and the nose lines. All right. Then comes the fourth stage, which is the nervous disturbances. Now, since arsenic has been so long in our body, it starts to affect our nerves. And what is the most common sign of nerve damage? You would feel tingling and numbness in your hands and feet, right? This is the most common sign of nerve damage. Okay? Tingling and numbness. When you perform, I hope you guys have performed the the neurological examinations. So remember those pins and needles that we use to check for sensations? They can get lost. The patient would complain of tingling and numbness, which is very common. All right, and he may also experience some tenderness of muscles. Okay, other symptoms would include headache, drowsiness, some vision impairment, and also disturbances with mental activity. He might feel confused. He might tell you that he's depressed. He's having some mental health issues. Okay, so the nervous disturbances can vary a lot, from simple tingling or numbness to slight headache to even drowsiness, vision impairment, or even impairment of the mental health. Lastly, arsenic is not particularly destroying our brain cells or the nerves. It can also affect our liver, kidneys, and even cause bone marrow suppression. So, for the treatment for chronic poisoning, firstly, remove the patient from exposure. That's the number one treatment. You can start with something called sodium thiosulfate, IV. You can even use dimer caprol, and rest of the treatment is symptomatic. You can expect complete recovery within 6 months to 1 year. Okay, if somebody dies of chronic poisoning, what would be the postmortem findings? Arsenic would be extensively present within the tissues, and that is why the tissues will not decompose. Okay, for a very long period of time. So when you're going to perform an autopsy on somebody who had chronic arsenic poisoning, you would see that everything's well preserved. Okay? The findings include great loss of flesh, fatty degeneration in the liver, heart muscles, and kidneys. So you would find fatty degeneration on almost all of the organs. There would be congestion of the GI lining, obviously, because of, remember, even if they're not taking it by the oral route, it's being re-excreted into the GI lining. Remember, that is why you would see congestion in the GI tract. Okay, nails and hair would show arsenic in them. Okay, and remember that hair must be plucked out along with their bulbs, because that is where arsenic lies. Their urine and feces would also show presence of arsenic. Okay. So for diagnosis, remember we talked that arsenic is radiopaque. So you can just perform a simple abdominal X-ray, and that would show some pictures like barium swallow ones, and you can just easily pick it up. Arsenic can also be detected in hair and nails, or even in urine. Okay. For medical legal aspects, it can be used for suicide. Very commonly, it's used for homicide. Remember, because it has no taste, it has no smell, so you can easily administer it. And it can also be used for stupefying. That is, you can mix it with tobacco or cigarettes. Okay? So then you can have some accidental poisoning as well. Like Remember, we talked about paints, that paint can have arsenic, children can chew it, but adults, then even industry workers can get exposed. It can be used as a kettle poison as well. And now, love filter. It's not filter, it's a filter, something else, pH filter. Now, what is this? It's just basically those fake doctors can use arsenic to treat diseases ranging from a common cold to cancer. Okay, and I don't know how people see changes within their health after using arsenic, but it is being used. Okay, and it can also be used as an abortifacient. So now we just need to talk about the advantages of homicidal agent as a homicidal agent. Why? The lethal dose is small, it's cheap, it's tasteless, it's odorless. Okay. Acute poisoning can be confused with cholera. Again, a very significant advantage. Okay. And in cases of chronic poisoning, it produces a delayed death. Okay. Now, okay, so I'm sorry, this is just the last slide. I'm really sorry. I know it's getting too long. Please hang in there. So for the disadvantages, it retards fetal action. Remember, so when someone's going to perform postmortem, they can easily pick it up, right? For the poison does not deteriorate. It will be present within the viscera even after several years. It will not deteriorate. Okay, so it can easily be picked up at a postmortem. Okay, heat will also not destroy this poison. And in chronic poisoning, arsenic, it will be present in hair, nails, bones, and skin. So therefore, it can easily be detected. So that's about it. Thank you so much for your patience and cooperation. I hope I am clear. Okay. So do you guys have any questions? I'm not sure how to. Okay. What do you mean by love filter? Well, it's a term that the quacks, which are the fake doctors, they use it. It's used as a medicine, basically. Okay, it's used as a medicine to treat various symptoms of diseases, and I don't exactly know how it's being used and how is it treating certain ailments, but it is being used by the fake doctors. Okay. What else? Any other question? Arsenic is water insoluble. Okay, wait. Water insoluble. So how come its poisoning is common in people using their water? Well, it is insoluble, but it is present in water. Okay? And when it gets exposed to this environment, it gets oxidized. And when it's oxidized, it is soluble, and also it can get into the GI system. Okay, wait, let me rephrase it. Pure arsenic, when not exposed to air, like when it's not oxidized, it's insoluble. But when it gets oxidized, like when arsenic gets exposed to the environment, it gets oxidized, and the oxidized form of arsenic is water soluble. Okay, and when it's water soluble, it can easily get into the system through drinking well water. Right? I hope I am clear. Any other questions? Any other questions? All right. So Okay, so somebody raised a hand. Yes, you can ask me questions directly. Um, okay, most welcome, Afreen Arif. So I guess you guys are pretty clear about the topic. It was pretty easy. Most welcome. I hope you guys enjoyed it, and I'm sorry if something was not clear to you. Right? Most welcome, students. You've been a lovely audience. Thank you, and take care.